staffy was an example of a distressed doggy post-surgery. So the hospital can be an unfamiliar and unpleasant environment for some patients. So in the case of this little one, we sprayed some Adaptil on the bedding. We turned off the bright lights and we closed the door to the kennel room. So the hospital area was quite noisy outside. The patient that was seeing the commotion of us walking past, funny people walking past, different animals walking past, other noises and smells. So just by just reducing this overload of stimulation, we were able to limit that, and the little staffy became a lot calmer after this. Recording observations of the animal's behaviour. So we have some helpful cage markers in the clinic. So these are placed on the patient's kennel, and these are really great because that means everybody's aware to be wary of these patients. Another place that we would mark so everybody is clear on the patient is on the hospital whiteboard. So say I've got a little canine who is a little bit nervous. I would just put a big note here. And I might write here something like fear aggressive, or please use a muzzle, or please use appropriate PPE. And that's very important. So all the staff look at this, it's very clear and everybody is aware. Rub that off later. Finally, we need to put an alert on the patient's file. So anybody adjusting the patient history can see clearly. So I will just demonstrate how to do that too. So if I bring up the patient's file, I can put here alerts and I can insert header, and I might put here care can be nippy or something similar. We can put a little logo here, and I want this to pop up on client details, invoice, animal details, appointment arrival, record and appointment details. Save. So that when I bring up anything to do with this patient's file, this little alert pops up. And then that's very helpful for all staff who maybe haven't been in contact with this patient before. Okay, so I'll now discuss and implement a long-term plan for undesirable behaviour with my supervisor, Sarah Bedford. Hi, Sarah. Hi. Okay, so some solutions for some of the more challenging patients. So stressed or vocal patients. We do get stressed or vocal patients in hospital, as seen as in that little staffies example. First, obviously, we need to eliminate the potential that it could be vocal because we're in pain or something like that. So once we've just eliminated that, then we can sort of move to adjusting these behaviours. Yep. Cool. So things like using Adaptil on the bedding, and placing an Adaptil marker on the cage so staff are aware. We can also place a blanket or towel over the front of the cage, just hanging it over here, so that the patient isn't overwhelmed by the activity outside their room. We can dim the lights and shut the door, further limiting the potential stresses for the patient. And we talk and handle the patient with comfort and soothing voices so we don't further stress them out. Excellent. Cool. The next one is aggression in patients. So this one we do see a little bit. It can be displayed in patients from pain, stress or fear. And as nurses, I think it's important that we need to look out for these signs prior to handling the animal so that we don't get hurt and the animal, and they don't get further stressed out. So factors to look out for are darting of the eye, whale eye, shivering or cowering in the corner of the kennel, avoidance in both eye contact and physical proximity to us, and then more obvious signs like growling and lunging towards staff members. Okay. it's really important that we're always made aware of these sorts of animals. So again, using the little cage card markers. So I've printed these out. I think they're a good idea to use. Cool. All right.
Very clear.
Also marking the hospital whiteboard, as I showed, and also putting an alert on the patient's file so that all staff are aware. We would also maybe mark on the kennel if 2 or more people were needed to handle the patient. And appropriate PPE must be used in these cases. So we have an assortment of different sized muzzles here for different sized patients, and there would be also a marker on the patient's file if we had to use a muzzle for our own safety. Another thing is we often get patients come in with loose or damaged or not properly attached collars. So I propose that we use our slip leads because we know that these are of high quality. These can't, as long as these are used properly by staff, so we're all trained in how to use these are a lot safer than having a collar come undone when we've got a patient pulling on them. And all staff need to be trained in safe animal handling techniques to minimise risk to ourselves. Very rarely we have an exceptionally difficult patient where we would need to maybe pre-med before we carry out the TPR, but that one's not as common. Normally the owner will warn us about them prior.
Cool. Very good.
So again, with my supervisor Sarah Bedford, I'm going to discuss some modifications to the enrichment program. So reasons that we would need to modify our enrichment program. Some examples are some brachycephalic breeds have more difficulty getting at certain toys, so we would need to adjust appropriately. Some pieces of equipment might be too small for a certain patient and they would pose a choke risk. So these would not be appropriate for a Rottie or a Kelpie, these would be appropriate for a little Pomeranian or a Chihuahua. So if we have a dog who is a known chewer, we would really limit or not give any enrichment toys, because of course that causes risks of ingestion and foreign body. We definitely don't want that. And finally, a dog with certain dietary requirements, we would need to be wary with how we are administering enrichment. So if we had a previous pancreatitis patient or someone who's on gastrointestinal diet, then I'm not going to put liver treats in his enrichment toys. And again, this needs to be documented on the patient's cage card. We also have the helpful markers that alert all staff, so putting it on the the hospital whiteboard and also on the patient's clinical file on vision. We would record any difficulties for the patient, any problems with equipment, or any other specifics, so that all staff are aware.